week basis. To talk about the struggle of small businessmen and businesswomen to afford health care is the owner of HEL' Hell's Kitchen Restaurant Catering in Highland Park, David Boris. David, thank you.
So good evening, and thanks for coming out tonight. I'm not a doctor, so I can't offer you conversation on specific solutions to the skyrocketing cost of patient services. And I'm not a pharmaceutical company employee, so I can't help explain how to control the astronomical increases in drug costs that we're experiencing in the past several years. And I'm not an insurance company executive, so I can't offer a defense of surging profits in the face of millions of additional Americans falling victim to a complete lack of health insurance coverage or a serious deficiency in the scope of that coverage. But I am a member of a group that is responsible for the health insurance coverage of over 50% of American men, women, and children. 160 million Americans get their health care coverage from their employer. And let me tell you, we are in a crisis. I'm a small business owner with 25 full-time employees, and my health insurance premiums are absolutely out of control. Less than a year ago, we were forced to ask our covered employees for the first time in the 16 years since we began offering coverage to contribute to the premium, effectively a pay cut for those who wanted to continue their good coverage. Some opted to reduce their coverage, the quality of their care, and increase their risk, while others opted to participate in a health savings plan, the details of which we're all still pretty sketchy on, but it offered the benefit of no cut in their take-home pay. In a little over a month, I'll sit down with my office manager, whose responsibilities cover a myriad of areas, as they often do in companies with less than 50 employees, and we'll begin the annual arduous task of selecting a collection of plans that may or may not be suitable for the health needs of the 14 employees that we currently cover, as we strive to keep premium increases under 20%. And more than likely, we will not be able to cover those increases completely, and our employees will be looking at yet another effective pay cut if they want to keep their current coverage levels. Meanwhile, Big Pharma and the private for-profit insurance companies will once again pay out millions of dollars in bonuses to their top executives as they continue to put profits before people. Something has got to change. I come here tonight not as a Democrat, not as a Republican, but as an American business owner who's feeling the pain of a healthcare system in crisis. As a business owner who feels the crushing burden of being expected to bear the brunt of that crisis, even as we are unable to afford to provide coverage to 11 of our 25 full-time employees. And I come here as an American citizen and father of 3 who finds it unconscionable that even at these prices, my country does not even rank in the top 40 industrialized nations in infant mortality rate. The most expensive health care in the world, $5,000 for every man, woman, and child in the United States of America we spend, more than double what the next highest country pays, and we have more babies die before they reach their first birthday than 41 other countries. It's unconscionable. Over the past 7 years, we've seen the ranks of the uninsured swell by over 8 million people, and the underinsured by even greater numbers. Almost 1 in 4 Americans now lack adequate health care coverage, they're either uninsured or underinsured, and there appears to be no end in sight. The wealthiest nation in the history of the civilized world, and we can't figure out how to guarantee the most basic, inalienable right, the right to live a healthy life, to over 1/4 of our population. It's unconscionable. So for me, this is not a political question. This is a moral question. Business owners like myself should not be put in a position where an employee's retention is influenced by their or their spouse's or their children's health history. We should not have to balance hardworking employees' contributions to our life's work with the drag their families' health issues might put on our bottom line. You know, we're not supposed to know that the group premium is going up 10%, 15%, 20% because one individual spouse had a kidney removed or is battling breast cancer. We're not supposed to know that an employee's child was diagnosed with juvenile diabetes or is taking human growth hormone. We're not supposed to know that an employee has taken the courageous step of seeking treatment for a debilitating condition, physical or mental, but we do know. We all know. We're companies with under 50 employees. We're families. We know. And we know that if we weed out those negative health histories, weed out people with medical problems, we'll lower the cost of our coverage. We'll improve our bottom line. This is a dilemma most small business owners do not give into, but it's a moral choice that shouldn't even exist. It is time, well past time, for us to undertake real reform of the healthcare system in this country, and this is not going to be possible by tweaking around the edges of the current for-profit private health insurance company-driven system. There is not a model out there that can provide affordable universal coverage that depends on those companies alone. We have got to have a government-sponsored option. It is well past time we stop considering health care as some sort of privilege for the wealthy and the powerful, and understood it as the fundamental human right that it is. And well past time to make the financial commitment necessary to turn our values into actions. There's a lot of costs, a lot of narratives on costs out there, and they all need to be carefully vetted and examined. But at the end of the day, this is a moral as well as a fiscal imperative. This economy cannot be poised for growth if we continue to disenfranchise over 25% of our population from quality health care. If we are to compete in an increasingly competitive, hot, flat, and crowded global economy, we'll need to marshal all of our resources, but especially our human resources. And we'll need those human resources to be educated, skilled, and healthy. So I hope that you'll join me and these others tonight in demanding of our elected representatives that they begin to legislate for this moral necessity, a government-sponsored option to the profits before people, greed-incentivized, private, for-profit health insurance industry. And then we'll be able to tell our children and our children's children the story of how we overcame the profit mongers and took another step toward the continued creation of a more perfect union. And they will be proud to be Americans. Thanks.